Hi everybody. This is not another little more closer video, but this is a discussion. We have Prateek Sharma and Aarthi Selvan with us. They'll introduce themselves, but before that I'll introduce myself. I'm a counseling psychologist at Pause for Perspective and also the social media lead. And we are here to talk about narcissism. And this idea came because of social media, because of the way narcissism is spoken about on social media or around us, and how diagnostic or very it's very distressing to read those kind of diagnostic criteria about narcissism and then having to question relationships, having to question people around us, and then think about what is narcissism, what is not narcissism, and a lot of misconception around it. And we are here to talk about it and look at it from different perspectives. So let Aarthi and Prateek introduce themselves.
Okay. Hi, my name is Aarathi, and I am a clinical psychologist, also the founder at Pause for Perspective. I think I am excited to have this conversation. One of the things that I do want to sort of at the onset state is our stance, right? My stance and our stance at Pause is one of looking at sort of the systemic influence of systemic influence and structures and how they influence us as people in our own relationships with ourselves and with people. We're constantly looking at people's identity locations and how those influence discourse, how that influences relationships, and so on and so forth. So that is where I'm coming from. So you will see some of that being articulated in our conversations as well. Yeah. And Prateek, would you like to?
Yeah. So, hello everyone. My name is Prateek. I am a clinical psychologist in training currently. I am currently located in Bangalore at KIMS, and but I come from the state of Madhya Pradesh. I have been covering mental health and its intersection with different kinds of discourses, such both politics and relationships and other perspectives for like past 3-4 years now. And yeah, I think speaking of stance, like I mostly try to take from psychodynamic thinking, but I also tend to open my doors to other perspectives, and which mostly apparently comes from socio-cultural understandings of what we try to call disorders or mental illness or whatever. So, yeah.
Thank you for being here, Prateek.
Really yes, thank you for being here, Prateek. Thank you for being here, you too, Aarthi.
And you for setting this up. But anyway.
So we have a few questions, and we can't go through all of the questions, but the major theme around it is what is narcissism, the etiology of it, how does therapy work around it, and maternal narcissism. I think these are some of the main things that have come out of the questions. We'll discuss this, but let's begin with what is how it's spoken about outside, right? Or what is diagnostically spoken of narcissism. Yeah. Prateek, would you like to go?
I think before I come to the diagnosis part of it, the diagnostic criteria, I think it has a very glamorized form, narcissism as a term, and I think we tend to sort of misunderstand that who, and it's I think it's a human tendency in us that we try to attribute the first thing that's going around to anything that comes across. So it's always like if someone we tend to see who's like, who is, full of himself or full of herself, that way is we like, oh, this is a narcissist, and then apparently we also turn to different kinds of distress and trauma and where this is coming from, and we say, oh my, my parents have always been narcissistic, my this person has always been narcissistic. Now, it's not to really say that there may not be any truth to that, but I think the tendency to attribute it to a term without being able to really understand it, and being able to not being able to understand yourself in that diet, basically. So, and then there's the whole pop culture, which is Trump is also a narcissist, and this person is also a narcissist, and so the whole even the whole the media culture which portray politicians or celebrities as narcissists. So it's kind of become ingrained into the general population to be used. And it's not just narcissism. You did people throw around all kinds of terms for that. Like someone just has different kinds of moods all the time, so they're all borderline now, right? Someone just gets a little more angry, so they're also borderline. They're also cluster B, and so, and then we all have those OCD, and I'm so much OCD about this or that. So it emerges from this general tendency to find some kind of a label to explain what is happening to us and what we're experiencing. And of course, the media has a big role to sort of aggravate it in general. And so narcissism was mostly associated with, there was this whole family of psychopaths and sociopaths and narcissists, right? So, and now we have like all kinds of online tests to like see if you are a narcissist or not, or see if you can self-assess, do a self-assessment of if you are a psychopath or not. So those are also there. There was a lot of when DSM-5 came out, there's a lot of before DSM-5 was coming, the personality disorder work group where they have to decide what to keep and what not to keep. Narcissism was actually on the verge of being dropped out, the narcissistic personality disorder, that is. And that was because that it has a very low kind of diagnostic validity, which means that people were not really able to diagnose personality disorder, because and it sort of blew up the whole idea of categorical personality disorders, in the sense that what DSM says is that if you meet 5 out of 6 criteria, you have a personality disorder. If you don't meet, you don't have a personality disorder, right? And that was, and everybody was like, no, this doesn't really work, because we are not able to diagnose personality disorders, and what we need is a more dimensional understanding, a more fluid kind of a picture, that people can have different kinds of traits, and and a good way to actually assess that. But that didn't happen, and of course DSM-5 got narcissistic personality disorder, and the criteria is that basically that person with very high grandiosity, and they have a very, very high sense of entitlement, and they become extremely envious of other people's. They have, I think there's this lack of empathy also is one of the criteria, that they are not able to really identify with the needs of other persons. And yeah, and they are always just in fantasies about this power, the gaining whole power, and financial power or political power or whatnot. So this is the whole criteria. This is the picture. This is the, and what DSM criteria are based on is that, as we know, that it's based on external behavior, right? It's what the person tells you, or what you can observe overtly is what the criteria marks is. So if you're meeting X out of Y criteria, you will be diagnosed a narcissistic personality disorder. But that doesn't really happen, what we actually found in research, because first thing first, it's so narcissism is so hidden inside the core that doesn't really come across as nobody really comes and says, I have a lot of grandiosity, can you diagnose me with something, I have a lot of sense of entitlement. No, these things are inferred when two people are talking. And people with who might have very high kind of narcissism, they don't really come to clinics asking for help. They come with complaints of say depression. They come with that, I am not able to know who I am, and I'm not able to get other people to love me, and they actually meet sometimes criteria for depression. And so this is the kind of picture that we get, and it creates a lot of confusion, both clinically, I would say, in my experience, but also in the general public, as we are seeing. So and so the whole idea of this discussion is to kind of so like you said, I think earlier, that to demystify it, basically, that it is not really this, this mysterious thing that happens to certain people who probably come from Mars or something. It happens all around us, and there are so many factors involved in that. So yeah.
So, Prateek, when you said that they come in with other things like depression, or saying that I can't find somebody to love me, that somehow brings a little bit of empathy, right? Like, we are able to look at what this person is telling us and why that's happening, right? And it's very relational when we say that we have an understanding that it's relational, right? And I think there is this, how it's spoken about relationally also on media or on platforms where there's a certain pattern to it or things like that, that's also very attacking the person, right? And Aarthi ma'am, do you want to give some more, give insight into that? Like, what's your understanding of that sort of?
Sure. I think I find it, I think, Prateek, thank you so much for what you said. It makes a lot of sense, and I really like the sort of unpacking of what was happening before DSM-5. I'm thinking about how, the way that we see people, the way that I see people, is from a perspective of, what brings them here, no? And like you said, what brings people here is not they're saying, I'm this like horrible narcissistic person. It sounds like a horrible thing, right? To even sort of diagnose oneself like that. And so when people are coming in, we're really looking at variety of things, right? We're looking at what brings them there, who is this person, what are their struggles, what are their strengths, what is this person sort of grappling with in their relationship, so on and so forth. And when we're doing that, right, it's hard to kind of I'm not saying that we don't see that people are feeling envious of something, or people want a certain way of looking at, or want a certain way of being held, and so on and so forth. Of course, we know that people and people's needs are varied, but I find it very hard to kind of label of narcissism. I find it very hard to sort of use it in my work, and it's blown up in the way that it has, because, and I'm also wondering about that, like, who is it benefiting when we blow up a label like that, right? What are we doing with something like that, right? Like, and often I've had people who will come in and say tell me that they've been in relationships with people who are narcissists, and I wonder about, like, knowing that, how does that benefit you, right? What does that allow for you, does that allow you to make and create boundaries? Well, perhaps boundaries are necessary anyway in relationships, right? And being able to speak for oneself is necessary in relationships. Now, the thing is that it doesn't happen, and it's not so easy, and it's not so easy because there are systems in place that we're all responding to, right? So if we're looking at, I see a lot of couples in practice as well. So if you're looking at couples, and we're looking at, let's say, cishet couples, there is a measure of what it means to be gendered male and female in these relationships, right? And how have they come together, right? Something like marriage is itself a patriarchal system. So when they have come in marriage, there are expectations of who the other person should be, right? And as a result, what is the power dynamic within this relationship? How is the relating happening in the relationship, right? What is needed for one another that is not happening, right? So these things become so important, right? Like, and I feel like for me, there is no purpose of a label like narcissism. Because we want to be able to hold space for people and their responses, and look at how one might be able to sort of stand in their truth as much as they can in the systems that we are living in. No, so I think for me, that's the biggest sort of gripe I have about the label of narcissism and the way that it is used as well. Yeah.
I think the picture, the whole picture sort of changes once you go beyond the label and ask the question why. Why is this happening? Why this grandiosity, if there is grandiosity at all, and why? And when you start asking the question why, the story starts to unfold then. Because right now all we are seeing is that, oh, this person is, this person just disregards others, he has no empathy for other people, he can't. But why is it that they can't see it? What is really happening inside that they have to bring about this kind of presentation in them? And which sort of brings us to the whole developmental perspective of it. Like there is this developmental trajectory that happens, right, from beginning to, like, from your birth to how you grow up, right? And I think the social systems have a lot of role to play to bring about these behaviors. So to give you an example, Freud was the first person to give the term narcissism, and from there's this whole story about Narcissus who was looking at his own picture in the lake, and he was so in love with that picture that and later he actually died. Freud did not see many people with narcissism in his practice, and he considered narcissism to be more of it's sort of a healthy kind of a aspect of normal development, basically. And other writers, basically like Erich Fromm, for example, who draws a lot from communism and politics and psychoanalysis, they actually say that narcissistic personality, like pathology or disorder, actually came from modern times, because in modern times is when we actually came across, when capitalism grew and the consumerist culture, how they play with the person's appetite for things, for attaining things, materialistic lives and all those things. That's where we actually kind of saw more of this. And Freud actually kind of didn't really want to, he thought that people with narcissism were not really analyzable, and like they were not, and so he never saw. But people who came after Freud, and I think I'll talk a bit more about Heinz Kohut and how they actually gave a more empathetic understanding of narcissism. So I think what Aarthi, you said, it makes a lot of sense, because you can only understand and see something like narcissism when they are being played out in these social structures, right? So be it because every behavior has to do with how it's being presented outside, right? You will see politicians, you will see people in relationships, and apparently couples who come for therapy, there you see a lot of this kind of dynamic in which either one person has a lot of narcissism going on with them, and then the other person is like the recipient of it, and then you deal with that. So it only happens within power structures, because there's no other way to actually understand it. Like you can't look at a person with not just narcissism, but any kind of mental illness. You can't just put them in a room with nothing and then see how it is, unless they're actually interacting with these systems. So I think that's where it comes from.
I'm thinking about how the way that narcissism is spoken about outside confirms that it comes from these systems, right? Because men somehow are more narcissistic, and then mothers become narcissistic, or parents become narcissistic. Like these are all power places or authoritative places in the social structure, right? Which confirms that it is coming from a system, right?
And also, interestingly, then the questions that we got asked on our Insta page about what do we do and how do we deal with, I was thinking about how that's actually not a question pertaining to narcissism itself. It's a question pertaining to things like, the systemic things, like, can I actually break up? Is it actually, is divorce okay? Is divorcing a parent okay? Can I not be so enmeshed in relationships? These are the actual questions sometimes I feel, versus like, how do I deal with a narcissist? No, like you're asking a different question altogether, and the question is, can I not? And that's the thing, right? Like culturally we are asked to sort of persist in relationships even after they've sort of long after their expiry dates, right? And we're asked to be a certain way, even if you're gendered or if you're in any relational dynamic, that we don't realize that there is something within us that has said, okay, bas ho gaya, you know, and yet we sort of persist because there is an idea of duty boundedness in relationships, no? Yeah.
And I
Yeah.
wonder if this is the same thing happening within a person with narcissism as well. Because you see, there's this, like, I think here we are coming towards a bit towards the inner world of them. It's always this false self that they have to keep on maintaining outside, because like this, because this is the way when I be more proud of myself, when I show excessive pride and grandiosity, and that's the way I get valued, because that's how I have been valued when I was a child. And that comes to the point that behind all this picture, behind all this excessive grandiosity, and there's a lot of hollowness within. There's a lot of shame, basically. And shame is perhaps the most dominant emotion or affect that you'll see in someone with narcissism. And there could be two kinds of responses to that. So someone who is able to achieve and someone who's not able to achieve. So there's two kinds of narcissism, and a lot of authors have called it different names. Someone have called overt versus covert type. Someone have called oblivious versus hypervigilant. So what happens is, if I'm able to achieve what I want, that brings out a very grandiose outcome. But when I'm not able to achieve, that brings out a very depressive kind of outcome. And then I become this very self-critical person, that I don't know who I am anymore, and I need to do something to be able to recognize and all. And so, but see, again, like whenever I'm using the term narcissism, right, it might strike people, oh, he's talking about something very negative and something that is our enemy, something that we should fight it. No, I'm talking about a very soft, genuine, vulnerable kind of individual who has been through a lot. And that's why these two kinds of polarities you will observe, and two different types, if you want to call types, of people who might show with a lot of narcissism inside. So behind this grandiosity, there's a hollowness. And I think Karen Horney, who actually basically found feminist psychology, she gives a very interesting analogy to it. She says that you have observed economic inflation, right? So in economic inflation, you see that the prices go up, right? Everything is just so expensive. But what's really happening is that the economy is going down, right? And there's this absolute mayhem within the economy. And then she gives this term called psychic inflation, in which she says that behind all this presentation that we see of people with narcissism, there's actually no adequate foundation for that. And they're always in struggle to actually fill something that is lacking within, by having such a big picture outside. So in Hindi, I think I will translate in English, but in Hindi we call this "Uchi dukan and fika pakwan." There is this muhavra, right? Like there's a good high-end restaurant with a lot of lightning and everything, but the food really sucks. So I think that's what's happening inside.
Prateek, when you say that, I'm looking at it from a very gender-based perspective, right? When you say that there's so much shame, and then how I was valued because I was able to achieve something, right? Or that how I was valued was viewed in a certain way, right? And how in patriarchy growing up, right, like men are valued in a certain way, like they have to be achieving, they can't show emotions and things like that, right? Then of course they won't know what empathy is if you're not allowing this person to feel their emotion, right? And then there's so much buildup of shame if they don't achieve something, whereas if it's a woman, then whatever we do, like if it makes me think when they say mother ka narcissism hai na, mothers are valued, or like the life becomes about kids, right? Like they get valued based on how much they can give the family, how much they can give the kids, and things like that, right? And their identity is really just that way. And then uh, and then how do these behaviors show outwardly, that we tend to label as narcissism, but are actually these, like you said, these hollow gaps that are looking to be filled, right? Like it feels like this vulnerability that they can't express but are asking for something, right? Yeah, Aarti ma'am.
No, I was going to say the same thing actually. I totally agree with you. And like, I like what you, I mean, really what both of you said about this, this front that I need to, I mean, who doesn't have a front, no? Like, who doesn't have a persona that they need to project to be a certain way and to be accepted? And, and, and the distance that our socialization has moved us so far away from a language for representing ourselves most accurately, that we can't, like, there is sometimes no language because you're not either gendered or otherwise not allowed to speak a certain way about yourself or own something about yourself that is present. Yeah.
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 I think it also reminds me of like when Nida spoke about the gender perspective. Uh, the difficulty that people with narcissism have is to tolerate that they can be flawed. And what is the flaw of being a man in a patriarchal society? It is that you can't really express emotions, that you can't really be a person uh, who can do mistakes, who can be however they want to be, which doesn't have to conform with the heteronormative sort of template. And uh, and this perhaps what get added to it, right? So it's like I can't be someone who can do a mistake, and if I do a mistake, it's someone else's fault probably.
Yeah.
And that's where the projection sort of takes place, that it's actually the person outside, because I can't do these things. And so this is how it all falls into place.
Yeah.
And I think, yeah,
Yeah.
yeah,
No,
please
go
go.
ahead.
I
So
was just sorry.
I was just saying that
Yeah.
uh, so we've discussed how we look at narcissism, right? Like there are so many underlying vulnerabilities that are there, and the label really doesn't, like, it's very negative how it's perceived, right? And to really understand where this person is coming from, what is happening and things like that, right? But in a relational space sometimes it becomes difficult to do that, right? And this is where I want to talk about how therapy works with somebody, right? With couples or with somebody who may or may not have narcissistic traits, right? Still not the label, but just the way they are asking for something or the way they are presenting what they really want. I think that's let's move towards that because we don't have much time.
Oh, we don't have
Yeah,
much time. Okay.
yeah.
Right. Okay.
We can make part two later.
Yeah, yeah, yeah. I just so see, label is like something. Diagnostic labels are sort of double-edged swords, and I have written something about this on Scroll, and I think labels sometimes are helpful, but when they are helpful, that they are recognized in the context. Like if the person is able to identify that, this is something that really helps me because it provides some kind of an answer to me. uh, and at times labels are might be helpful in communicating between two kinds of professionals, for example. But we don't even have to say that, labels are this and that. Nobody is going to like if you call them a narcissist. Even diagnostically, nobody's going to like it. Like, you are a narcissist, I'm a narcissistic, yeah, no, nobody's going to like that. So it's futile to actually use labels in context of therapy. I'll just quickly go to say what really comes about in narcissism in terms of, because I think therapy does emerge from understanding etiology, and by etiology we mean that what is the source, where how does it coming about, right? So after Freud and Kernberg and all these people, then Kohut was the one person who gave a lot of understanding of narcissism, and he actually said that people with narcissism are very vulnerable individuals who have been through a lot of developmental traumas. And by developmental traumas, he didn't mean to say that very harsh kind of environment, a lot of abuse that is happening. He said that it happens within relationships in general, right? So when a child grows up, they already have some kind of a grandiose self, which is quite healthy in nature because they need it. So, right, so they need to survive this. So when they feel hungry, when they feel like really like raised up because they're not able to meet those demands, they will sort of produce, like they will sort of in imagination produce an image of the mother, and they feel that oh, I can do this thing, when I cry, there's this lady comes and then feeds me, and so there's already this grandiose self that is building up. And Kohut says that it grows up to develop in a very healthy form, but if there is very cold, very harsh kind of environment involved, the parenting is not really adequate, and the person is left with that thing, and the person is not able to sort of decatastrophize it, because the person needs to come across some kinds of disappointments in life to be able to understand that you can live with the disappointments as well. So what they do is that they can go for either idealizing someone too much. So sometimes narcissism is not really about I am this and that. It's sometimes about you are so great and I am a part of you, and because you are so powerful, I'm a part of you, I also become very powerful. So a lot of idealization that we see a lot in people with narcissism. So there's sudden idealization, and then something happens and they will drop you, they'll suddenly devalue. Some people like to call it splitting as well. Sometimes what they would want to do is they would engage in what Kohut calls a twinship, that they will want to be seen alike with the other person. I am also like you, and what is not so alike will be actually just I'll discard it, I'll put it aside. So there's a lot of these defenses that take place, which become a part of therapy, and from where therapy actually comes from. So Kohut says that people with narcissism actually require a lot of empathy in therapy, and you can't really you can't really attack them all the time. You have done this and you have done that. That's just going to create more damage. Rather, what you need is a lot of patience with them. You need a lot of patience. You need a lot of holding, because what you are trying to do is you're trying to fill these gaps that have been there from their development, right? And how their psychologies have come to form. And there have been these gaps, and they've not been soothed enough in that way. Because you see, what happens is that whenever the child is soothed, they learn that tendency and they start to self-regulate. So the parent, when the child is crying and the child is all over the place, the parent comes and their parent does this, right? And it forms some kind of a template within them that I can do this myself as well. But imagine a child who has not received this thing, and who is always living in this space where I just have to rely on myself. So the response that comes about, that this is all I know, that I can only just rely on myself, and it comes across in a very rebellious form, that I am the person who is the most powerful, and I am the person who can do this thing, and I don't need anyone else, which actually inside, if you see, it is such a longing for the other person to be there for them. So it's surprising. Like Nancy McWilliams is a brilliant psychotherapist. She writes it very wonderfully. She says that you will see that in therapy, the person with narcissism will actually say, he will attack the therapist quite a lot. That you are not good, you're not this and that. But outside, they will do a lot of. They will say how good my therapist is. How nice they are in terms of treating me or something like that. So they actually need this person to be there. And the goal of the therapy ultimately at the end becomes about helping them to come to this terms of self-acceptance with that it's okay to make mistakes, it's okay to have flaws, it's okay to not be perfect all the time. So there's a lot of perfectionism also that you see in people with narcissism. It's not just about OCPD, about obsessive compulsive personality, and that says a lot about how blurry these boundaries are between personality vulnerabilities. So and it happens a lot between the therapists. So and there I think Aarthi would also tell us how the power dynamic plays on, because in the therapy room, therapy for people with narcissism, borderline vulnerabilities, it's a lot of relational therapy. So what happens between two people and how both of them bring about their own templates of seeing the world, and how that is being processed in therapy is actually very helpful. So, and we know this by research as well. I can say outrightly, there's no CBT for narcissism. So there's a lot of but therapies that focus on transferences, therapies that focus on kind of like helping the person to see what is going on in the other person's mind, what we sometimes call mentalization. So those therapies are much more effective in this kind of process. Yeah.
Thank you so much for that, Prateek. I'm sure like mental health practitioners are watching us, and I think this is a great way of sort of conceptualizing the work that needs to be done in therapy spaces. It is important to actually call out that this is work of therapy, that it's not the work that relationships or partners should do for each other, right? Like I often have like this is a struggle, right? Like both as mental health practitioners, people who are in psychology, or people who are just empathetic, right? Like people tend to believe that, wait, I can see underneath mein kya hai, so I should actually be there for that person, even though they're not articulating all of these things. And no, that's not the labor that one should do in relationships. Yes, it's work of therapy, and therapists are trained to be able to hold space and have skills to do that. And that, partners in relationship are not expected to do this sort of labor of sort of being there for someone in ways that the person has not even articulated to do. So I think I just, because I'm always afraid, because there's that question that has been asked on Instagram, how do we sort of, can I feel empathetic towards them? Yes, sure, you can feel empathetic, but to know that you are also boundaried as an individual in relationships and partnerships, and that there is something to say about feeling like if you feel like you're done in a relationship, to be able to process that in your own therapy work, in your own spaces that allow you to sort of grow and heal is important. It's one thing that I wanted to add as sort of an extension to what you were saying, because I don't have much to add for what do we do in therapy itself. I think you've provided a great frame for understanding and holding space. Well, I say that I have one piece to add, actually. The one piece that I would like to add is therapists are, the skill of therapy is also to understand and conceptualize in the way that you have been able to help us to and think about, Prateek. Another piece that I would like to add is therapy is both holding space and also space that sort of gently calls into accountability for people, right? Like, how do we keep accountable the people that we see and what they may be and how they may be interacting with the spaces on the outside, is also part of looking at people that we see in our work. And it's not just specifically to people who may have or may experience something that is akin to narcissism, but just in mental health work and people that we see. We're also looking at that piece is important to add to as well. Yeah, and just those were the pieces I wanted to add.
I think that also reminds me. I hope we have some time, like
Yes.
5. It reminds me of, because Nida also mentioned when we were talking about this. She also mentioned that if we could get the Indian perspective in this. So in Indian perspective, actually, we see a lot of what theorists like to call narcissistic extensions. Like we see a lot of. I think Nida has a power cut. It's okay. It's okay. That's all right. So in the sense that, I'm the parent and I couldn't, achieve certain things. So my offspring will is going to achieve and make me proud and everything. So and of course, somewhere every parent really somewhere wants that. But when it takes a more chronic kind of a form, and where that's the only pattern involved between the children and parents, that it takes a very kind of a very traumatic turn. What Aarthi said also reminds me, because she says, because you also see couples and all, and there's a lot of this thing going on where, I have to take responsibility for this. Yes, I can empathize with them, and maybe, and but what it does, it in turns causes them, it puts them in turn in a more spiral of guilt and shame and everything, because then they're like, oh, now that I'm able to understand what they are really going through, I feel more guilty to actually, feel angry at them and all these things. And this one person asked me this thing. We were in the session, and this client asked me this thing. Now I'm able to really see what was going on with my parents, and what. And I told him that it's very good that you're able to do that. It must be very helpful, but you are still allowed to, and you can still permit yourself to feel angry at them for what they must have done or not done. And that's the thing, because people can leave relationships, right? People, we always say, we always come with this assumption that, why didn't they leave the relationship, it was so toxic and whatnot. But it's so difficult to actually leave. It's for children who have had like all these narcissistic parents, for partners, and despite having resources, despite having financial resources, despite having social resources, but the pull from this relationship, right, the pull within this dynamic is so strong that they can't come that they can't they're not able to overcome the guilt that comes with just leaving the person, right? You can ask them to make boundaries, you can teach them how to create boundaries, you can do everything with them, but to be able to overcome, to come to terms with that, you can still feel angry at someone with the whole love and the work that you want to do, the compassion that you have. So it's always this feeling that love and hate can't exist together, but they can, and that's what something that we actually give them in therapy. And that's what I think both therapists and client learn, that you can both be attached to a client and try to also sometimes get angry at them. So the idea that both love, both this positive so-called and so-called negative emotions, this is not a part of the whole deal. And no matter how much you want to really help and feel compassionate, you don't have to do all the work, and you can choose not to do all the work while still being able to while still being compassionate with them.
So before putting it together and summarizing, because we have to end here, some of the things that came to my mind while listening to both of you talk was that everybody comes to therapy for self-actualization. Right? Like, we need to know who we are, what we can do, what is our potential, right? And when you said that the way that a narcissist feels like they are valued is through a relationship, or like they can't accept their flaws, or they project and things like that, right? Anything. It just, to me, sounds like, I believe that we all have narcissistic traits because we have been through some kind of trauma, considering the Indian context of parenting, right? So how do we And then when we understand this, right, we are not only holding empathy for the other person, but also for ourselves, like compassion for our flaws also, and then acceptance of our flaws, right? But if we keep like attacking the person, or we keep labeling, then we also tend to ignore that this doesn't exist in me, like they're saying, oh, this is separate from me, right? But that's not really true. Like we all have these traits, and to really unpack them without the judgment and shame, but to see them as vulnerabilities, right? That's what is, I think, needed. And that even if you do understand, like you both said, right, like you don't have to do the work of a therapist in a relationship, right? Or like the emotional labor in a relationship, right? And the idea that you need to stick to a relationship, you need to stick to a marriage, also comes from these systemic ideas, right? So really unpacking it for yourself and for how it makes sense to you, right? And within the relationship, right, having a conversation about that. It's not like this person will murder you.
Let's hope not.
I don't know. Okay, not to go that far, but yeah. So I think, and I learned a lot, Prateek. I mean, I didn't know that much about the history of DSM and how narcissist ka label came about and all of that. It really clarifies a lot of things, right? And I think on the kind of questions that you've asked, like from that place of understanding the vulnerabilities of this person, right? I think right now on my mind, this question is, how do we change the narrative around narcissism on that social media level, and like just how do we talk about it to just in that way, right? Collectively, how do we talk about narcissism? How do we hold accountability for shaming somebody? Right? That's something that's on my mind. Yeah. And any closing statements from you both?
I think we can do that by having more docs like this. I'm not.
Yeah, that's
otherwise,
true.
I'm not very, not very hopeful about what we can do with the media out there, because.
Yeah.
But it's also what I think it also trying to turn because see the information, the knowledge that there is about psychology and about psychiatry and all, it's very limited, right? It has a very limited kind of audience because it's so jargon. So what we're trying to do today is try to jargon free everything. Like it's not really all this mystification or whatever. Like it's not very difficult to understand.
That's right.
Narcissism, and you said it very rightly, we all have narcissism. You can't survive without narcissism. When an artist creates art, when they paint, that's kind of their own reflection, their own narcissism. When a filmmaker makes a film, that's their own perspective, right? So trying to change the connotation that it exists in everyone, and it's with every personality trait or any kind of thing. But it's always about this economic concept of what is too much and too little, right? It's something that goes to an extent that starts creating difficulties for them, for the people around them.
Yeah.
And it's sort of kind of show that okay, maybe this person is someone who might need some kind of help.
Yeah, and I think when that said, Aarthi ma'am's statement that how do I hold my truth, right? That really stands out to me. Like that is something that we learn in therapy. At least for me, it was something I learned in therapy, right? And that's the work that we need to do. Some people might learn it otherwise, but that is something that we need as a core of surviving in this world, right? Not just surviving a narcissistic relationship, if we have to label it, but just this world full of oppressive systems, right? Yeah.
Thank you so much. I don't have anything to add. Otherwise, we'll just keep be like, wait, one more thing and one more thing. But yeah, we'll stop for today. Thank you so much, Prateek. Thank you, Nida.
Yeah.
Thank you so much.
Thank you. It was a lovely conversation. Yeah.
It really was. It really was. Yeah.
Thank you, folks. I
right.
hope to see you soon too, Prateek. Yeah.
Yeah.
Bye. Yeah.
Bye.
Bye, folks. Yeah.